This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about the possible causes of elbow pain. So for elbow pain, I would group it into 4 different areas. You can have pain on the outside of your elbow, or the lateral aspect, pain on the inside of your elbow, the medial aspect, pain on the back of your elbow, the posterior aspect, or pain on the front of your elbow, the anterior aspect. And there's different anatomic structures there that can cause pain, so let's kind of talk about them. On the outside of your elbow, by far and away, the most common culprit is tennis elbow, which means that the tendons that go from your wrist and insert onto your lateral epicondyle, or the outside of the elbow, are kind of degenerated. They're not really so much inflamed, more think of it like a frayed rope. That'll be pain when you push right on your elbow and when you lift your elbow up. So that's like a real common cause of pain that's on the outside of the elbow. You can tear a ligament of the elbow, that will cause some pain out there as well too, but that's less common and much more subtle, so I'm not going to spend more time on it. On the inside of the elbow, you kind of have the opposite. It's all the tendons that flex the wrist, and they insert on something called the medial epicondyle, and that's called golfer's elbow. So similar sort of thing, and that's pain kind of right when you touch it. On the back part of the elbow, there's not a ton there. You have something called an olecranon bursa, so if your elbow gets all puffy, and there's like a big kind of soft thing there, sometimes there's a bursa there that gets inflamed, and you can have something called olecranon bursitis. Or rarely you can have pain back there if you tear your tricep tendon, which will be a lot of bruising and swelling, and you'll be unable to kind of extend your elbow against gravity. So that can cause pain back there. On the front of the elbow, you're looking at the biceps tendon, where the biceps tendon inserts. If you tear it there, you'll have a lot of swelling in the elbow, and that'll be loss of a little bit of loss of bicep strength, but also loss of supination, meaning turning your palm upwards. So that'll be more pain on the front. You can take your finger and hook your biceps tendon, and if you can't feel that, then you may have done that. That's a surgical thing that needs to be taken care of relatively quickly. There's other things like elbow joint arthritis. Sometimes people only get that at the ends of the motion when they straighten or when they bend. That can kind of feel like it's in the center. And that sort of thing. But and I said there's other ligament injuries. You can injure the medial ulnar collateral ligament, and that's when people get Tommy John surgery. So if you're throwing or doing those sort of activities, you may need to look into it a little bit more. But yeah, the most common things are tennis elbow, golfer's elbow, olecranon bursitis, and the anterior is not quite as much in the front, but biceps tendon tear. So I hope I was able to answer your question about what causes elbow pain. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but note that I can't respond to your specific medical condition. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.